series, and we are getting ready to do the checklist to health, and we're continuing on. So let's get our screen share on and our timer. There goes our timer. So here we go. We just ended with this. Remember, this is our checklist to health, which is if you follow this checklist, you would be extremely healthy. And so if you go to backtolifechiropracticky.com and go to the Back to Life system, you will find a tab for the Back to Life checklist to health, cheat sheet to health. And we're in the Back to Life 5 minutes to health workshop series where we're just doing these every five. We do these every couple of days, and we just do it for 5 minutes, keep you excited and motivated. And so we are on cardio training. So cardio training is one of the very important parts, and it's one of the 7 essentials wellness attributes that we use on our checklist. And so we were just finishing up on aerobic and anaerobic. You should be doing these 2 to 4 times a week with starting intensity level. If you use the cardio club and the training sheets that we have on the Back to Life system in the cardio section, it helps you start off in an area that's safe for you and then work yourself up. And then once you can do that, then we use the HIIT that's found on our which is more anaerobic, and then which burns more fat, and we do that, and that's on our Back to Life system in the cardio section too. But then you just check these off, and then I really like, you need a heart rate timer, heart rate monitor like that, and if you don't have one of those, we actually have that on our Back to Life store, and we have a couple of these cardio machines that we like on our Back to Life store. That's like off our Amazon affiliate program. So we just made it easy so you can get it. It goes through Amazon. But these are like the things. If you get on our website and download these forms, it just helps you figure out if you're a beginner, moderate exerciser, active exerciser, serious exerciser, and then it kicks you in to where you need to be. So then what you do is you start off at the lowest setting, 15 minutes, and then you would do 2 times a week, and you would do a light intensity, which would be a heart rate that you would figure out for you. So it's just a percentage of your maximum heart rate, and then you would work your way up to either can go more times a week, which I would do probably 4 times, and I would still do 15 minutes, and I would do light, and then I would start adding time. And then once you could max all that out, then you would switch to light to moderate intensity. And then once you get through that, then you start with the moderate exerciser. Then you would go 20 minutes. You do that 2 to 4 times a week, light to moderate. And then you would just keep working your way up and up and up and up and up. And once you do this, because this is more aerobic exercise, then you want to switch over to the HIIT training, where the HIIT actually, it takes your heart rate. Like it wants you to ramp your heart rate up and down, up and down, up and down. And so what they found is as you're going up, you're burning fit calories, but when you go back down, come back up, you burn fat calories. And plus, it's just good for your heart because it makes it, it's actually making your heart work. It's not staying at one level. It's actually, making it go up and down, which is one of the things that's you need to do. So that's the HIIT, and then that's on our website too. You just got to download it, and then it's an Excel form, and you just put your age in there, and all these things change for your age. But you actually need to be able to do this before you can do that. So and then we have our walk run club, and we just started our soccer club, and that was that is now we're at Back to Life Chiropractic. So we'll have to fix that. So the next on the checklist is strength training. These are one of the essential things. You want to do 3-4 times a week, 20 to 40 minutes. Then you want to start we had several different sheets and things to do on our website, but these are the easiest ones to do, or simplest ones. And so, but you always start at the minimum sets, and then you work way up. And then these, we actually start off at 1 to 3 times. 1 to 3 times. I actually do that on purpose because we see a lot of people in a lot of pain, a lot of back problems, and so it's really hard sometimes to get over a back problem. But you have to do it gradually. And one of the things you do need is strong muscles. But strength training is one. If you go through our score sheet and do our Move Well workshops, you'll see that it actually inhibits a lot of cortisol. It helps with the stress cycle. So, but these are important forms to get, and we have other forms too. So, the strength training, you want to be doing 3 to 4 times a week. You can use bands or barbells. We have forms for both, so and we do minimum resistance, upper, lower, front, and back. So that when you see that, you're like minimum resistance, upper, lower body, front, back. So you want to do your whole body. And what we do is we do the neck, the cervical spine, the neck, because a lot of people don't do that, but that's in our things. And then we do every single thing. So any questions about that? Next week we'll talk about flexibility and how you need to improve on that. So remember, if you go back to lifechiropracticky.com, then all these forms and everything is on there. And then past, if you go to our YouTube channel, subscribe to it, then all these past videos are on there. So it's very informative.